I'd like to take this opportunity to talk about the topic of infertility. My name is Paul, and I wrote the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. As you can tell on the cover of my book, I have two daughters who don't necessarily look like me. I'll get to that story in just a little bit. But there are many reasons why you could be facing infertility issues. I'm not going to get lost in the weeds with all the different scientific explanations of everything. It could be because of disease, it could be because of stress. I know several people who ended up getting pregnant once they unloaded all their stress. And then, of course, there could be hereditary issues. In my case, my issue was cancer. I was facing a diagnosis and had no time to think about family. I was 22 years old and I was told I needed to store sperm right away because the chances were pretty good that my treatments would leave me infertile, unable to have biological children. Now, there are many options, but before you get to that, there's all kinds of testing. Now, unfortunately, it has been 23, 25 years since I was last tested, and prior to that, it was even longer. Back in 1988, it was a simple sperm test, and they told you, nope, you can't have kids. Yeah, you don't have enough sperm, it's not worth storing. I wrote about it in the book, but when I got married and we wanted to try having children, I wanted to give my wife the option or the opportunity to have biological childbirth. So we dealt with looking for sperm donors and then going through scientific processes to give her the experience of birth if she wanted to do that. Um, those options, medical lifestyle, medication, surgery. There's something called an intrauterine insemination. I want to make sure that I say these things right. In vitro fertilization, something called ICSI, intracytoplasmic sperm injections, which I don't necessarily understand that one, and of course donors. There's all these things that can be done, but the last time I was checked, which, like I said, was 25 years ago, there's a whole other process now to determine if, in fact, that treatment had left me infertile. For instance, they're looking at the hormone that makes sperm. If my body was actually making it, then there was the possibility that I was dealing with a blockage, which would require surgical intervention, but I would have been able to have children biologically. Turns out my body is not producing that hormone to produce sperm, so that was it for me. Now, there are other non medical options available. As I pointed out, my daughters are adopted. They are adopted from China. That was a choice that was made. Uh, there's also, you have domestic adoption, foster care, with the goal of adoption, donor embryos, mentoring, becoming a guardian or kinship giver. And then there are those that choose to be child free, and they're happy with going through life with doing things with each other, trips, other things. The hard part is being willing to accept counseling to deal with this decision. When the decision came for us to adopt, I had already come to my finality of not being able to have biological children, but my wife hadn't. And it got to the point where so much was being put into scientific processes. There was the chance that we weren't going to be left with any options at all, and we had an option with adoption, but we had to make a decision. And the way that I presented to her was the most logical that I could do, with my having accepted my fate, her needing to accept hers. And that was it more important for her to actually biologically give birth to a child, or was her ultimate goal to being a parent? I know for me, I wanted nothing more than to be a parent. So, but it wasn't up to me. She was going to be carrying any children if she decided to do that. But we both understood that time was running out, money was running out, and we made the right decision. We have two very happy, beautiful daughters. Um, their parents aren't together anymore, but they're still getting the love from me just as they did before. It's a difficult decision, but I can tell you that as a 37-year cancer survivor, um, being a dad to my daughters is the best part of my cancer survivorship. And if you are so inclined to want to become a parent and you're able to become a parent, and I know plenty of survivors who have defied the odds and have children of their own, um, biologically, and they're happy and healthy kids. That's fantastic. I'm happy for everyone. If your goal is to be a parent, I hope that you get that chance, as a cancer survivor. It really is the best. It helps keep you focused on life. I often say my life is not determined by cancer. Sure, I talk about cancer a lot, but when it comes to my life is about my daughters, and that's what matters to me most. Until next time, this is Paul's Heart.